What's up, guys? Welcome back to my channel. Today, I'm going to answer some of your favorite questions on my popular videos. Let's go. Okay, as you guys can all see, this is not a simple hernia. It's not like most hernia repairs. This is a very complicated hernia, but I want to address some of your favorite questions to see if I can teach you about hernia repairs. All right, the first question is from Brianna Crum. It's actually 3 questions. And the questions are, do all hernias require mesh to repair? What if you encounter a smaller hernia while doing a tummy tuck? Is that something that you were able to repair right then and there? All right, I want to address the first one first. Do all hernias require mesh to repair? So the answer is no. Very small hernias can be primarily repaired, which means we just put stitches after we reduce the hernia sac, and that's all we have to do. Now, if a hernia is larger, there are very good studies that indicate that they recur a lot more often if you don't use mesh repair. So in larger hernias, we do use mesh. All right, part 2 of your question, what if you encounter a hernia during a tummy tuck? Do you fix it? And I get this question a lot, and I encounter this very frequently. So oftentimes I'll have moms who've had laparoscopic procedures where they use the small incisions to put cameras in to take out gallbladders and things like that. And oftentimes that's enough of a weakness where they'll get a hernia through that old incision. Now, when I'm doing a tummy tuck and I'm elevating the skin, if I just encounter one of those, because I'm general surgery trained, I will reduce the hernia. And quite often when I'm fixing the diastasis recti, I basically fix the hernia in the midline at the same time. All right, Starlight Galaxy 222. Why did the skin look scrotal? All right, the next question. It's Derek_NOTDC. I've had a lot of my friends have issues with the mesh. Is there another option other than the mesh? All right, Derek, there are all kinds of mesh on the market. Some are dissolvable meshes, some are non-dissolvable meshes, and it just depends on what the problem is as to whether we have to use mesh or not. So in my hand, I have a piece of dissolvable mesh that I use quite frequently. In about 18 to 24 months, this will disappear and go away, and they have no problems at all. Now, I hear your concerns loud and clear because sometimes we have to use non-dissolvable mesh, and when you're fixing hernias and there's bowel and the potential for infection, it can be disastrous. The truth of the matter is most people that even have non-dissolvable mesh, they do just fine and they never have a problem, but everything has the potential to have complications, and that's just the nature of surgery. All right, the next question is from It's Levy, and she said, whoa, was it congenital? How does this affect digestion? So what does she mean by congenital? Sometimes we're just born with hernia defects, and that means when it's from birth, we call it congenital. The second part is, how does it affect digestion? Well, if the bowel gets stuck in a hernia sac and it gets twisted, you could get a bowel obstruction, and that's why when you have a hernia, you really should see someone to try to get it fixed. Lax Lebza asks, how and why does this happen? Is it dangerous to live with? Well, in some previous videos, I've discussed this. There's several ways that you can get hernias. If you have a prior incision, that's a weak point and you can get a hernia. If you're obese and carry a lot of internal weight, you can actually kind of tear the muscle and get a hernia. The same thing that can happen with pregnancy. We see pregnant women, because of all the internal abdominal pressure, they can get umbilical hernias and their belly buttons pop out. So is it dangerous to live with? Ironically, this is a really cool question. The smaller the hernia, the more risky it is. The larger the hernia, the least risky it is. Let me explain. When you have a small hole, if a piece of bowel gets stuck in it, it gets strangulated and it will not reduce on its own, and that can cause death to the intestines, and that is a bad thing. When we have large hernias, the intestines tend to go out into the hernia and they can freely go back inside of the abdomen, and so that's less of a problem. So that's why when you have a really small hernia with things that are stuck in there, we encourage people to get them fixed as soon as possible. Okay, the next question is from Scrubs and Glam. I love your name. Can you explain a thoracic hiatal hernia? All right, let's review a little anatomy. The esophagus goes through the diaphragm, and where it goes through the diaphragm is called the hiatus, or a hole where it goes through the diaphragm. Once the esophagus goes through the diaphragm, it goes right into the stomach. As you can see from this picture, the stomach is pretty big. So what happens if you have a weakening where the esophagus goes through the diaphragm? Can you get a hernia there? And the answer is yes. part of your stomach, the upper portion of your stomach, can herniate through that same opening and get stuck in the diaphragm. The reason we call it a thoracic hiatal hernia is because the stomach was in the abdomen, but now it's gone through the diaphragm and it's sitting in your chest cavity. This can be dangerous for many, many reasons. The blood supply to the stomach can be cut off and part of the stomach can die. When that happens, it's called necrosis or tissue death, and if that happens to the stomach, you can become very sick. Some of the other things you may note if you have a hiatal hernia is difficulty swallowing. That's a huge issue, and a lot of heartburn. So in these cases, you have to see a special surgeon. Usually we involve a chest surgeon called a thoracic surgeon and a general surgeon to reduce the stomach back into the belly, fix the hernia, and you're good to go. All right, WAS 9. In these cases, would doing an open procedure be better than doing it laparoscopic or robotic assisted? For cases like this that I showed you in the beginning, that is actually a procedure called a component separation of parts, which is a big abdominal wall reconstruction. In those surgeries, it can only be done as an open procedure. It cannot be done robotically or laparoscopically. All right, there you have it. Hernia Repair 101. Dr. Ricky, out.